Do you love sports, whether basketball, football, or just regular running? We all take certain risks while playing sports, and one of the most common is ankle sprains. Well, not only ordinary people, but even professional athletes suffer from foot injuries. LeBron James, Neymar, and Alexander Zverev have all experienced serious ankle sprains. In daily life, you might experience a foot injury from being tripped during sports or stepping off a stair incorrectly. Do you think an ankle sprain is just a minor issue that can be resolved with 2 days of rest? In fact, this is a common misconception. The ankle bears the entire weight of our body, and an untreated ankle sprain can easily lead to habitual sprains and joint inflammation. Therefore, ankle injuries should never be taken lightly. In this series, I will explain how to reduce the risk of spraining your ankle and emergency treatment and rehabilitation methods after a sprain. According to the Wikipedia, sprain is a soft tissue injury of the ligaments within a joint, often caused by a sudden movement abruptly forcing the joint to exceed its functional range of motion. Therefore, in reducing the risk of spraining your ankle, protecting the ligaments is utmost important. Before presenting the specific method, I will explain the structure of the ankle and the mechanism of sprain in this video. This is the model of the human lower limb. At the ankle part, the bony protrusion near the thumb is called the medial malleolus, and the bony protrusion near the little finger is called the lateral malleolus. As you can see, our ankle is mainly composed of three bones: the fibula, the tibia, and the talus. The tibia and the fibula form a joint cavity to accommodate the talus. This makes the three bones form a stable and immovable structure. Furthermore, this structure results in a significantly greater range of motion of the talus in the front than in the left and right directions. We focus on the talus. When viewed from the top, the shape of the talus is a trapezoid that is wider at the front and narrower at the back. This is the model of ankle extension. When the ankle is extended, the wider part of the talus moves forward, while the narrow part remains within the cavity. Therefore, the left and right movement range of the talus is greater than that when it is in a normal stance. This results in the following situation. When an ankle is in an extended position, once it is subjected to the excessive lateral torque, the left and right movement of the talus can easily exceed the limitation of the ligaments, thereby causing the ligaments to tear or even rupture. Therefore, when we are going downstairs or jumping, when an ankle is in an extended position, it is more likely to sprain. Now, let's focus on the ligaments. On the medial malleolus side, there are four ligaments connecting the tibia to the talus, the tibia to the navicular bone, and the tibia to the calcaneus. These four ligaments are closely attached to form the deltoid ligaments. The deltoid ligaments is very thick and strong. On the lateral malleolus side of the ankle, the talofibular ligament fixes the fibula and the talus, while the calcaneofibular ligament fixes the fibula and the calcaneus. It is obvious that these ligaments are independent of each other, and they are thinner and finer than the deltoid ligaments on the medial malleolus side. Therefore, the several ligaments on the lateral malleolus side of the ankle are prone to tearing or fracturing compared to the deltoid ligaments on the medial malleolus side. The most common ankle sprain is the rupture or fracture of the anterior talofibular ligaments. This is because its location causes it to be stretched the tightest and subjected to the greatest force when an ankle is extended. Therefore, once the ankle is subjected to the huge lateral torque, it will rupture. Of course, all the other ligaments also have the risk of tearing or fracturing when an ankle sprain occurs.